distinguished delegates, we have had 2 days of productive discussion. Thank you for your excellent participation. I hope you also managed to join the warm-up session on connecting vital events registration and gender equality earlier this morning. Before we move on to today's deliberations, I would like to reiterate the ground rules for our discussion of this agenda item. Given a compressed schedule for this meeting, we ask for your support to tailor your interventions mainly to issues for discussions or action only, and to keep your interventions to no more than 3 minutes. I strongly urge delegations to keep interventions brief and focused. You will be alerted by the chair when your 3 minutes are up. Thank you for your attention. We shall now proceed with agenda item 5, vital statistics production, dissemination, and uses, harnessing civil registration data for decision making. The document ESCAP/MCCRVS/2021/5, vital statistics production, dissemination, and uses, harnessing civil registration data for decision making, was circulated by the Secretariat for this agenda item. I would like to invite Mr. Ramesh Silva, Technical Specialist, Health and Social Inequalities, Population and Development Branch, Technical Division, UNFPA, to introduce the agenda and summary of findings of background papers.
Thank you, Mr. Chair. Can you hear me clearly? Are you able to hear me clearly?
Yes, we can hear you.
Thank you. So, distinguished delegates, it's my pleasure to present you the background for this session on vital statistics production, dissemination, and usage, harnessing civil registration data for decision making. I will present some of the findings from the document and address the purpose of this session. Next slide, please. The principal basis for this session is the formal document titled Vital Statistics Production, Dissemination, and Usage, Harnessing Civil Registration Data for Decision Making. The document was developed as part of the Connecting Vital Events Registration and Gender Equality Initiative, known as Converge, a global initiative to connect vital events registration and gender equality, led by the UN Population Fund, UNFPA, and supported by the Government of Canada. Next slide, please. Civil registration and vital statistics data are critical for the monitoring of the 2030 Sustainable Development Agenda. 67 indicators benefiting from civil registration data. They are needed to report on indicators as diverse as infant and child mortality rates, to adolescent birth rates, as well as calculating the denominators for a wide range of population-based targets and indicators. The COVID-19 pandemic has also highlighted the importance of timely disaggregated statistics by cause of death and socio-demographic characteristics for designing and implementing and monitoring public health policies, as well as to detect emerging health crises and their impact on diverse parts of the population. Next slide. This figure shows the action status for key targets of the Regional Action Framework. As you can see, all targets of Goal 3 of the Regional Action Framework, which focuses on the production and dissemination of accurate, complete, and timely vital statistics based on registration records, require accelerated efforts. Goal 3 specifically builds on Goals 1 and 2 on the universal registration of births and deaths and other vital events, and on the provision of legal documentation of civil registration for all. Across the Asia-Pacific region, the availability of reliable data is limited by gaps in the registration of births, deaths, marriages, and divorces, and or capacity gaps in the statistical adjustment of incomplete civil registration data when producing vital statistics. Next slide. According to the targets under Goal 3 of the Regional Action Framework, just under half of countries in the Asia-Pacific region reported using registration records for producing annual vital statistics on births and deaths within 1 calendar year. Similarly, around 29 countries reported using registration records for producing annual vital statistics on causes of death within 2 calendar years, and 28 countries reported using registration records for producing an accurate, complete, and timely vital statistics report. In terms of the production of sex disaggregated vital statistics, many national statistics systems in the region rely on censuses and household surveys for the production and dissemination of gender statistics and sex disaggregated population statistics. Vital statistics generated from civil registration data need to be further utilized, especially when engaging key gender equality issues, such as gender-biased sex selection, child marriage, and preventable maternal deaths. Next slide. In terms of the vital statistics practices, the production processes of countries vary throughout the region. Some countries relying on analog manual processes to process civil registration data, and others using more automated systems to limit data entry errors and harness efficiencies. Quality assurance of vital statistics production processes require further strengthening in many countries across the region and can be further enhanced through progressive civil registration business process reengineering and digitization of civil registration systems themselves. When it comes to the usage of vital statistics, although there have been increasing efforts across the Asia-Pacific region to improve vital statistics production and dissemination, support for vital statistics end users still requires further attention. Undoubtedly, the COVID-19 pandemic has impacted the ability of many governments to maintain services and routine functions, including CRVS systems. At the same time, the pandemic has created more demand for timely, comparable, accurate, and disaggregated vital statistics, especially in the area of mortality. As the pandemic has continued throughout 2020 and 2021, CRVS systems in the Asia-Pacific region have adapted. Innovative approaches have been used to maintain death registration, including cause of death ascertainment, have been implemented in many countries. The pandemic has also prompted some countries in the region to increase investment in information technology to enhance CRVS services and ensure continuity of business processes. Next slide. Based on these findings, under Agenda Item 5, it is anticipated the conference will take note of the document and provide guidance and advice on how to ensure that all members and associate members achieve the goal of producing and disseminating accurate, complete, and timely vital statistics based on civil registration records. The conference may also wish to take stock of recent innovations during the COVID-19 pandemic in improving mortality statistics production, dissemination, and usage. Next slide, please. We're very fortunate during this agenda item to have two speakers share country experiences. Ms. Gulhumar Abdullaeva, the head of the Demographic Statistics Department of the National Statistics Committee in Kyrgyzstan, and also Ms. Thirika Chantalanavong, the Director General of the Social Statistics Department of the Lao Statistics Bureau inside the Ministry of Planning and Investment of the Lao PDR. Thank you, Chair. Back to you.
Thank you, Mr. Silva, for the introduction. Distinguished delegates, it's my pleasure to invite our special guests to discuss how to ensure that all members and associate members achieve the goal of producing and disseminating accurate, complete, and timely vital statistics, including on causes of death based on registration records. May I now invite Ms. Nurayam Sirjak Kiji, independent researcher, to take the floor.
Good morning, dear distinguished delegates. It's my pleasure to greet you. I'd like to thank organizers for giving me this opportunity to share the experience of Kyrgyzstan. So today I'm going to present the experience of Kyrgyzstan in improving the vital statistics at the legislation production levels based on the case study as part of the case study of vital statistics situation in the Eastern Europe and Central Asian countries we conducted last year. First, let me briefly introduce my country. Kyrgyzstan is a mountainous landlocked country in Central Asia with a population of 6.5 million. So one of the key achievements in production of vital statistics is digitalization of civil registration of vital statistics. So vital statistics is produced by the National Statistical Committee on the basis of civil registration data collected by 53 territorial offices. Since 2015, all data entered and stored at the digital software automated system ZAPS. At the same year, Kyrgyzstan has adopted the law on biometric data collection using Face ID and fingerprints. By the moment, more than 3 million people were enrolled to biometric registration. The main identificator of communication between systems is the person's identification number. So this PIN linked all the persons registered vital events to generate up-to-date identity information. The National Statistical Committee also benefits from a wider range of information available in the population register, especially in relation to demographics and population movements. Currently, the data is exchanged through the Tunduk interoperability electronic management system between the state bodies. As for the content,
Sorry for interruption. May I request you to speak a bit slow? Our interpreters are, facing a bit difficult if you speak a bit fast. Sorry, please.
Thank you. Sorry for my speed. As for the content, according to ESCAP and Norway Statistics Mission report on CRVS of Kyrgyzstan, in 2018, Kyrgyzstan was one of the main 3 countries in Asia that fully met the requirements of data of the UN Statistics Division for compilation of demographic yearbook. It provided all the 30 tables required by the UNSD. I should also note improvements at the legislation level. In 2020, the new law about acts of civil status was adopted to comply with the changing demographic processes, external and internal migration of the population, especially high labor migration rates. The new law also takes into account the transborder areas with Uzbekistan and Tajikistan, where many women give birth with no identification documents or have the status people without citizenship, and ethnic Kyrgyz from the same mentioned countries that repatriate to the historical motherland. If in the previous law, the registration of birth requires the ID of identification documents of parents, according to the current law, the medical birth certificate from the hospital is sufficient to register. Also, the new law allows registration on the place of addressing, not on the place of permanent residence. This provides easier registration processes, especially for the internal migrants. Another positive moment is cooperation of Vital Statistics Production Authority with NGOs, civil society organizations, and other researchers in producing gender statistics and youth statistics, especially in the area of gender-based violence. Despite these improvements, there are still drawbacks that need to be addressed, such as the lack of internal mechanisms of quality assurance and completeness of civil registration of vital statistics, low preparedness and technical skills of registration clerks. There is also a challenge of harmonization in the coding of most socioeconomic data with the vital events, such as education, status, occupation, etc. I hope our joint efforts will improve the situation with the vital statistics collection and production at the UN states. Thank you for your attention.
Thank you, Ms. Noram Sijak Gizi. I now invite Ms. Thiraka Chanthala Nubong, Director General of Social Statistics Department, Lao Statistics Bureau, to take the floor.
Dear Chair and Vice Chairs, Excellency, ladies and gentlemen, on behalf of the Lao PDR delegation, I would like to appreciate the Commission for organizing the Second Ministerial Conference on CRVS in Asia and Pacific. I also wish to convey our sincere appreciation and support for our participation in this session. As highlighted in the Lao People Democratic Republic's 9 National Socio-Economic Development Plan 2021 to 2025, civil legislation offers much potential in realizing our shared commitments to leave no one behind, and vital statistics can provide key insights into population dynamics and development progress. To ensure the progress in legislation is truly universal and fully inclusive, Lao PDR has paid attention to initiating implementation improvement in the CRVS system through the development of the CRVS Strategy 2016 to 2025, revision of the family legislation law in 2018, including revision of the Lao Statistic Law in 2017, and strategy for sustainable development of national statistics system in 2016-2025, and Vision 2030, and the planned digitization of the system, which aligns to the international standard and recommendations. Low coverage and completeness of legislation limits the use of vital statistics in Lao PDR as part of the midterm review for the CRVS decade in Asia and the Pacific. The government Lao reported that birth registration is approximately 43% complete, and the registration data on date is approximately 37% complete. In our case, population census and household surveys have provided complementary data sources to have been used periodically in produced vital statistics. However, vital statistics derived from high-quality civilization is, of course, the preferred source of data on vital statistics, given the ability to be updated regularly and the possibility to understand subnational differential in fertility, natality, and mortality. Also, due to limited technical capacity of our staff, Lao Statistics Bureau has yet to fully utilize all of these data sources to produce vital statistics report for the country. Dear Chair, ladies and gentlemen, as highlighted, Lao PDR still faces challenges and difficulty, particularly in compilation of vital event data from the current paper-based system. The law enforcement is weak. The civil registration system is difficult to access in rural areas. Capacity of civil registrars require further strengthening, and the transfer and synthesis of data requires further streamlining. Lao PDR has been strengthening our technical cooperation and financing support with UN country teams including WHO, UNDP, UNICEF, UNFPA, amongst others, and World Bank Group assistance to advance universal civil registration by 2030 and ensure high quality routine vital statistic production, dissemination, and uses. The government of Lao PDR is also working to increase public awareness about benefit of civil registration, especially in rural and hard tourist areas. Finally, we would like to express our gratitude to UNFPA and ESCAP for being going support and plan capacity strengthening initiative as we plan to produce first ever vital statistic report for our country to guide the civil legislation improvements. Thank you all for your kind attention. Thank you.
Thank you, Ms. Chanthala Nubhang. Before we move on to the formal deliberations, may I reiterate that due to a compressed schedule for this meeting, we ask for your support to tailor your interventions mainly to issues for discussion or action only, and to keep your interventions to 3 minutes at the maximum. Distinguished delegates, the floor is now open for comments. The first speaker, distinguished delegates from China, Ms. Geng Yun, Assistant Permanent Representative of China to ESCAP, Permanent Mission of the People's Republic of China to the ESCAP. And the next, after that, the next speaker will be ready from Maldives. So may I invite the distinguished delegates from China.
谢谢主席先生。人口问题始终是人类社会共同面对的基础性、全局性和战略性问题。人口数据为政府制定、实施和监测经济社会发展政策、人口政策等提供重要参考。近年来，中方不断提高 C2VS 数据质量，持续完善人口政策。生育政策调整完善步伐明显加大。2016年，政府出台两孩政策，并制定国家人口发展规划2016到2023年。2017年，中国颁布关于优化生育政策促进人口长期均衡发展的决定，实施一对夫妻可以生育3个子女政策。同时，中方实施积极应对人口老龄化国家战略。2019年颁布国家积极应对人口老龄化中长期规划。2020年“十四五”规划纲要也作出相应要求。2020年，中方克服新冠肺炎疫情困难，成功开展第7次全国人口普查，获取了大量详实的人口统计数据。高质量普查为高质量发展提供有力的信息支持。中方愿与亚太各国加强能力建设与经验分享，更好发挥人口基础信息对决策的支撑作用，携手应对人口趋势性变化对经济社会发展产生的深远影响。谢谢。
Thank you, distinguished delegates from China, for your statement. May I now invite distinguished delegates from Maldives, Ms. Mumina Abdullah, Director, Health Information Management and Research Division, Ministry of Health. Ms. Mumina, floor is yours.
Thank you, Chair. Good morning, distinct delegates. Maldives appreciates the work of the Secretariat on the comprehensive report on the current status of this agenda item. Birth and death registration in Maldives started early 1960s and have evolved over the years. Further, the pivotal role of the production and usage of vital statistics was strengthened with the enactment of the Civil Registration Law in 1992, which mandated that all births and deaths of Mollis needs to be reported and registered. Under this Act, Ministry of Health was also mandated to record birth and deaths, including vital statistics and death coding. As standardization of Mollis, as standardization of birth and deaths records had been a priority for Mollis, we ensured that the birth and deaths forms used across the country are aligned and with the relevant international standards, reflecting this in the digital systems for vital statistics that had been rolled out as well. The current decentralized online system continues to assist in streamlining the production of vital statistics for effective decision making. Such data is used to monitor national, international indicators, including the global goals, SDGs, and wider dissemination for national and international partners and stakeholder agencies. Moldis is committed to routinely produce and disseminate the vital statistics to the public. This is reflected in the series of Moldis Health Statistics and Moldis Health Profile, which is an annual publication by the ministry. Apart from this, the recent years, we have observed a shift in the utilization of vital statistics by other stakeholders, such as researchers, academia, and other donor agencies in producing academic publications. This had been both enabled a platform for Maldives to showcase their vital statistics in the global academic arena and gave exposure to Maldives to share their knowledge and experience with other countries. Although Maldives had made progress in the production and dissemination of vital statistics, there are still gaps that we need to address in developing a comprehensive and integrated CRV system, such as incorporating marriage and divorce components into the existing system. Apart from this, technical capacity to analyze vital statistics, responding to systems such as changes such as transitioning from ICD-10 to ICD-11, and annual monitoring of completeness of birth and death registration are areas that we still need support. Moldis appreciate ESCAP and other donor agencies' support in building capacity in this field, and we do hope that we will continue to receive this support and work towards achieving our shared vision. Thank you.
Thank you, distinguished delegates from Maldives, for your statements. Now may I invite distinguished delegates from Vietnam, Ms. Nguyen Thi Thanh Mai. My apology for not pronouncing your name correctly. Deputy Director, Department of Population and Labor Statistics, General Statistics Office, Ministry of Planning and Investment. Madam, floor is yours.
Thank you, Chairman. Ladies and gentlemen, I'm Mai. I'm from the National Statistics Office of Vietnam. First of all, I would like to take this opportunity to convey the greeting from the National Statistics Office of Vietnam. We highly appreciate the initiative on organizing the Second Ministerial Conference on CRVS in ASEAN and the Pacific, aiming to get everyone in the picture. We are proud to be a member of CRVS family. We wish all of you the best with our conference successfully. Ladies and gentlemen, in Vietnam, the government always gives the special priority for the CV registration and vital statistics because we understand that this work not only provide important evidence for development decision making, but also contribute to ensure right to citizens as stipulated in the Constitution. In particular, after 2014 Ministerial Conference on CRVS, we endorsed the National Action Plan to specify the goals, the solution, the roadmap for improvement CRVS in Vietnam for period 2017 and 2024. Under the framework of the National Action Plan, we implement a lot of tasks. Among them, we review and revise the legal frameworks on CRVS to an existing regulation to ensure the convenience for the people and to improve the quality of CV registration data in Vietnam. We, together with the Ministries of Justice, we piloting the electronic CV registration program and then applying them to the office across the countries and to help to strengthen the works in Vietnam. And we study to design the content into the population census and survey for about the CRVS information for provisions evident to better monitor the implementation of action plans. So for 4 years of implementation, Vietnam has achieved promising results. The CV registrations database and online CV registrations have been established. Birth and death and cause death of registration have been gradually improved. However, despite our big efforts, we have not achieved the expected result due to many objective factors in terms of experience, technical, and resource. But Vietnam still has a long way to achieve the goal of the National Action Plans. But we still fully aware the importance of a comprehensive CRVS system. We respect the commitment of the ministerial declaration of the ministerial conference, and we ensure to continue further our efforts to achieve the goal in the strategic action framework. We wish to receive more support, cooperation, and experience sharing from other countries and international organizations, especially UN ESCAP, to accelerate the process of change towards modern and progressive CREVS in Vietnam. Once again, thank you very much and hope you all the best. Thank you.
Thank you, distinguished delegates from Vietnam, for your statement. Now, may I invite distinguished delegates from USA, Dr. Sam Nurjun, Senior Technical Advisor, CDC Foundation, Contractor, Division of Vital Statistics, National Center for Health Statistics, US Center for Disease Control and Prevention. Sir, floor is yours.
Distinguished delegates, thank you for this time. The previous session, session 4, focused on the use of CRVS data to inform the objectives and targets of the SDG program. However, because CRVS systems touch on or contribute to many domains of government and society, CRVS data are relevant for many programs that involve defined objectives or targets. Most relevant will be health-related programs, but CRVS data can certainly be extended to programs in other subject areas, at the very least, to provide required demographic information. The more that CRVS data are used to respond to such domestic or international programs, the more the CRVS system will be valued by government. In my experience in the United States, international programs in particular catch the attention of ministers or senior level ministry officials. Data systems that can respond to requests from the UN, OECD, or others will be valued by government. You heard yesterday about the number of SDG objectives and targets that CRVS data can satisfy. Healthy People, a decade-long health-related program in the United States, typically uses CRVS data to satisfy about 50% of all program targets. Why is this? Well, there are a number of aspects of CRVS data that make them especially well suited for defined target programs. First, the fact that CRVS data are comprehensive means that in addition to providing national measures, CRVS data can be used to evaluate target status at the regional, provincial, and local levels. In many countries, CRVS data and census data may be the only sources available at the local level. And for countries with limited completeness of reporting, but that have good reporting in selected areas, this means CRVS data can still be relevant for providing data for defined target programs. Second, CRVS data by their nature are continuous, which enables defined target programs to evaluate progress, positive or negative, well before the end of the program period. In addition, CRVS data are consistent. Changes in definitions of data items are rare. This improves the quality of CRVS time series data. Next, because CRVS data are contemporary, collected at the time of the event, they do not require accurate memory of past events. And finally, civil registration systems are expensive, requiring extensive registration facilities and trained staff to obtain information required to produce birth and death certificates. But for vital statistics systems, because they derive information from civil registration, they are relatively low cost. That is, in addition to that, the cost advantage of vital statistics can be further enhanced if the healthcare system is required, at no charge, to complete reporting forms on births and deaths and provide those to the CR system. For all of these reasons, CRVS officials should be on the lookout for defined target programs that can benefit from CRVS data and in turn can benefit the CRVS system. Thank you very much.
Thank you, distinguished delegates from USA, for your statements. Would any other delegations from a member? Sorry. Now, may I invite international organizations and our guest now, our speaker now, Ms. Gurpreet Kaur Rai, Technical Advisor, Data Impact Program. So, Ms. Gurpreet, floor is yours.
Thank you, Chair, Excellencies, distinguished delegates, ladies and gentlemen. Complete and timely vital statistics are crucial for policymakers and government officials as a basis for planning and policies. The COVID-19 pandemic has highlighted the need for strong civil registration systems that regularly produce vital statistics and data to assess important indicators such as excess mortality due to the pandemic. The midterm review of the core vital statistics targets of the Regional Action Framework has provided sobering results. In 2015, between 41 to 51% of the 58 countries or areas in the region met the targets, and this increased to between 48 and 57% in the midterm reviews in 2020. Country initiatives were likely hampered by the pandemic, but we need to invest now more than ever in sustainable civil registration and vital statistics systems. As part of this goal to strengthen systems and turn data into action, Vital Strategies, under the aegis of Bloomberg Philanthropies Data for Health initiative, has collaborated with various partners, including ESCAP and UNECA, to produce several publicly available resources and tools. One such resource is the CRVS Systems Improvement Framework, which offers governments a collaborative and end-to-end guide to examine their current CRVS processes and determine areas for improvement. We are now in the process of developing a complementary technical guide to assess, identify gaps, and propose improvements in the production, dissemination, and use of vital statistics. We anticipate that this will be released in 2022. A resource kit titled The Production of a Vital Statistics Report was published in 2020. The kit has been used by various countries globally, such as Cambodia, Bhutan, and Rwanda. Earlier this week, we launched a virtual interactive course on the analysis and use of vital statistics that teaches participants how to conduct and interpret basic vital statistics data analysis. Chair, vital statistics using civil registration records are a key step in identifying health and social sector priorities, providing transparency and accountability for progress against health, demographic, and social indicators, such as the United Nations Sustainable Development Goals, and identifying health inequities. Understanding the completeness and quality of data can enable improvements in the overall CRVS system. To harness these benefits, Vital Strategies continues to work with countries to build their capacity for producing and using routine and timely vital statistics. I thank you for the opportunity to present.
Thank you, Ms. Gurpreet, for your statement. Now we come to an end of the statements, and I request the Secretariat to double check if there is anyone waiting for delivering the statements. Russian Federation. So there is none. Thank you for all delegations for your statements and interventions. This concludes the discussions under agenda item 5. Now we proceed to the next agenda item. For the next hour, we will discuss agenda item 6, implementing gender-sensitive civil registration and vital statistics systems through a life cycle approach as presented to you in document ESCAP/MC/CRVS/2021/6, implementing gender-sensitive civil registration and vital statistics systems through a life cycle approach. I now give the floor to Ms. Sarah Neves, Officer in Charge, UN Women Regional Office for Asia and the Pacific, to give the introduction of the agenda and summary of findings of background papers. Ms. Sarah, we are not hearing you. Can you unmute? Press the button.
I'm so sorry, Mr. Chair. Thank you very much. Can you hear me now?
Yes, it's okay now. You can proceed.
Thank you. I'm sorry about that. So, distinguished delegates, it's my great pleasure to present you the background for this session on implementing gender-sensitive civil registration and vital statistics systems through a life cycle approach, jointly organized by UN Women, UNFPA, Plan International, and ESCAP. This background document for the session provides an overview of the importance of adopting a gender perspective when improving CRVS systems to overcome persistent and structural gender inequalities, including in health, education, political participation, and economic empowerment. In the context of a person's life cycle, civil registration provides both the certification of identity for a newborn child and entry into the identity management system. Marriage and divorce registration are also key events with implications for inheritance and for the status of children and for women's rights. Civil registration also plays a critical role in notifying appropriate authorities of deaths, to ensure their reflection in the population register and the identity management system, which has implications for inheritance and for understanding causes of death. At the beginning of the life cycle, a gender perspective on birth registration supports efforts to tackle issues such as the completeness of birth registration for both boys and girls, to identify sex imbalances at birth, which may indicate the presence of gender-biased sex selection, and to create multiplier effects of accurate and quality data on birth registration for inclusive development. Despite potential and actual discrimination against mothers, evidence suggests no significant differences in registration rates between girls and boys. Although the higher than expected numbers of newborn boys reflected in the sex ratio at birth in some countries may indicate under-registration of births of girls, it may also indicate female infanticide, abandonment, prenatal sex selection, and sex-selective abortion. While surveys are a useful source of data for estimating registration completeness and identifying the main socioeconomic factors impacting registration, sample size does not enable a detailed analysis, which means that survey data shows relative equality at the national level, but could hide the disadvantages affecting girls in some subgroups of the population. Registration is often
Sorry, Ms. Nips, we cannot hear you.
for identifying women and girls access them without the headphones. Is this better? Hi, can you hear me now?
I think it's okay. Can you proceed again?
Okay. Yes, I'm sorry. So I will just recap that while surveys are a useful source of data for estimating registration completeness and identifying the main socioeconomic factors impacting registration, their limited sample size does not enable detailed analysis, which means survey data that shows relative equality at the national level could hide disadvantages affecting girls in some subgroups of the population. Civil registration is often the foundation for identity documentation. Without a birth certificate, it can be difficult to obtain national identity documents. So gender gaps in birth registration and therefore in legal identity can exacerbate inequalities, usually disadvantaging women and girls' access to public and private sector services, eligibility for protection from the state in their country of work for women who are employed illegally abroad, as well as intergenerational consequences of women's labour migration on civil registration, such as children left behind in countries of origin are less likely to have their births registered. At the same time, barriers to accessing marriage and divorce registration and the consequences of being in an unregistered marriage disproportionately affect women and girls. Effective and accessible civil registration systems have the power to prevent child marriage, enable targeted service delivery for girls already married, and to establish formally that a marriage has taken place, to provide full and equal protection under the law. Direct links between a marriage and a birth register can enable the registrar authorities to determine the age of the parties before completing a marriage registration. Recording of marriages and divorces is typically the most unreliable with the lowest data availability, especially in low-income countries. Yet these records often have the lowest priority for improvement. Complete death registration and accurate recording of the cause of death can generate evidence on the gender differences in certain diseases and causes of death in order to facilitate targeted health interventions. Sex disaggregated mortality data are necessary to provide quality information on diseases and health patterns, and gender patterns in causes of death are relevant to the design of public health policy. Women's deaths are less likely to be registered than births because there are fewer incentives to do so. Women typically own fewer assets than men, so inheritance rights are less relevant when a woman dies. Gender differences in causes of death include femicide, such as deaths at the hands of an intimate partner or dowry killings. Accurate, reliable, and timely mortality statistics are also critical, especially during health emergencies such as COVID-19. The pandemic has exposed deep gaps in death registration systems, especially in low and middle-income countries. Existing gender bias in death registration could be obscuring the pandemic's gendered impacts. Based on these findings, under Agenda Item 6, it is anticipated that the conference will share and discuss plans and strategies that are in place to incorporate a gender perspective when improving CRVS, to achieve the shared vision that by 2024, everyone in Asia and the Pacific will benefit from universal and responsive CRVS systems. The conference may wish to provide suggestions on the way forward. 2. First, strengthen a gender-inclusive approach to CRVS to ensure universal registration for all, with a view to allowing everyone to access services and opportunities, realise their rights, including to inheritance and property, and to be provided with protection from harmful practices such as child marriage. Secondly, to emphasise the importance of marriage and divorce registration for addressing gender issues and to discuss possible improvements in that regard. And finally, to address the urgent need for further disaggregation of birth and death registration data in order to support good governance, health and development, and give governments important tools to respond to future crises in an effective way. To inform the discussion during Agenda Item 6, Ms. Sophie Shook, Senior Advisor for Child Protection and Legal Identity System from Plan International, will begin by talking about barriers and bottlenecks young women and girls face when accessing civil registration services, and this will be followed by country statements. Thank you very much.
Thank you, Ms. Neve, for the introduction. Distinguished delegates, it's my pleasure to invite Ms. Sophie Shag, Senior Advisor, Child Protection and Legal Identity System, Plan International, to discuss on how to ensure gender-sensitive civil registration and vital statistics systems in Asia and the Pacific. Ms. Shag, you have the floor.
Thank you, Chair, and greetings to distinguished delegates. Plan International has a long history supporting governments in the Asia-Pacific region to increase birth registration rates, particularly for populations vulnerable to exclusion, like women and girls. More recently, we've been focusing our efforts on CRVS and digitisation in order to improve access to civil registration services by bringing them closer to where events take place, be it a hospital, a community health facility, or at home during a routine vaccination. Through our digitisation initiatives, we've been able to speak with many women and girls across the region to understand why civil registration is important to them and to document the bottlenecks and barriers they specifically face when trying to register. Many women and girls talk about the emotional and physical impact of having to travel to a registration office with a newborn, not wanting or being able to breastfeed in public, worrying about hygiene, sanitation, lack of shade as they line up at government offices with countless others. Others talk extensively about starting the process but dropping out along the way, many referring to the hidden costs associated with registration, such as travel, obtaining and verifying supporting documentation, late fees when they didn't even know there was a time frame. They talked about these costs resulting in conflict in the home, as they had initially convinced their husband that registration was free. Many mothers talked about not being able to register their babies because they themselves did not have a birth certificate or a marriage certificate. Marriage registration awareness is generally low across the region, yet it plays such a significant role in enabling access to basic rights, including a child's right to birth registration. Mothers also talked about not wanting to register their baby because they did not feel it was in the best interest of their child. For example, not wanting an official record or certificate that states the father is unknown, when, in fact, the father is known. He is just unwilling or unable to engage in the registration process. Unfortunately, violence against women and children is endemic in our region, even more so since the COVID-19 pandemic. We must ensure that babies born as a result of gender-based violence can access their right to registration by supporting mothers to navigate the civil registration system safely and confidentially. We've heard many amazing stories from women and girls who fought for their right to registration in order to break that intergenerational cycle we see all too often. women and girls in polygamous relationships demanding equal rights to registration for themselves and their children. Whilst technology has the potential to reduce many of these bottlenecks and barriers that women and girls are facing, as we know, technology alone cannot register a vital event. We need people to want to register, to actively seek out civil registration. Because in fact, it's women and girls who are driving the demand for civil registration. They are more likely than men and boys to initiate the registration process. Yet, they have the greatest difficulty completing the registration and suffer the greatest consequences for being unregistered. This needs to change. As we continue to invest in CRVS and digitisation in the region, we must ensure these investments include evidence-based research to understand, identify and document men, women, girls and boys' differing experiences when registering a vital event. We need to include a gender analysis of existing and emerging laws and policies and practices that govern civil registration. We must directly engage women and girls in decisions around system improvements to ensure we are responding to their specific needs as critical users of the system. Civil registration systems have the power to transform the lives of women and girls. We've seen this in countries like Bangladesh, who have successfully prevented potential child marriage cases by enabling real-time age verification through the civil registration system. A civil registration system can also identify girls who are already married as they come to register the birth of their first baby. The system could, if enabled, refer that young mum to a specialised service that supports her to feel safe and empowered in her home, given her high risk factor to experiencing gender-based violence. We've seen significant advancements in civil registration systems as we move closer to our shared target of all people in Asia and Pacific benefiting from universal and responsive civil registration systems. Let's continue to innovate and promote gender-sensitive and responsive civil registration systems that enable women and girls across their lifetime to reach their full potential. Let's ensure gender-inclusive approaches to civil registration are a collective priority for all. Thank you very much, and back to you, Chair.
Thank you, Ms. Serg, for your statement and clarification. Distinguished delegates, the floor is now open for comments. The first speaker is Ms. Geng Yun, Assistant Permanent Representative to China to ESCAP, Permanent Mission of the People's Republic of China to the ESCAP, followed by Ms. Hyung-Jeong Song, Deputy Director of Vital Statistics Division of Korea. May I invite distinguished delegates from China. Madam, floor is yours.
谢谢主席先生。CRVS 体系对于推进落实2030年可持续发展议程关于实现性别平等、保障妇女权利的目标至关重要。在性别统计方面，中国目前已形成一套较为完整的分性别统计体系，指标分布在健康、教育、经济、参与决策和管理、社会保障、环境和法律等领域。数据来源于各有关部门，并建有相关的统计制度，每年定期收集相关数据。同时，充分利用人口普查、1%人口调查、住户收支与生活状况调查、时间利用调查等，取得了大量的分性别统计数据。通过编制按年龄、性别和地域分列的统计数据，中国政府积极促进性别平等，促进妇女和女童赋能。中方愿同亚太各国加强交流， 通过区域合作，共同推动在亚太区域内性别统计数据的生产、发布和使用，建立并完善性别敏感的 CRVS 体系。谢谢主席先生。
Thank you, Ms. Geng Yun, for your statement. Now, may I invite distinguished delegates from Republic of Korea, Ms. Hyung-jeong Song, Deputy Director of Vital Statistics Divisions. Madam, floor is yours.
Hello, can you hear me?
Yes, you can proceed.
Okay. Dear distinguished delegates, thank you for sharing experiences and giving me an opportunity to deliver a statement. I'm Hyun-jang Song, working at the Vital Statistics Division in KOSTAT, Republic of Korea. It's my great pleasure to join this session. In Korea, almost all births, deaths, and marriages are registered, and there is no difference in registration between men and women. So, and the sex ratio at birth has been decreased. So, under today's agenda, I'd like to focus on gender disaggregation in Korea's vital statistics and its implications. In Korea, most of items in our vital statistics, including births and deaths, are disaggregated by gender. And further detailed information is provided about the mothers in the birth data, maternal mortality statistics, and more. For example, the birth data have mother's age and the duration of pregnancy information. The maternal mortality data also have information on the ages of mothers. With this gender disaggregation in vital statistics, we are able to provide more useful information for establishing policies. And more detailed statistical information on mothers in the birth data can contribute to making health policies for mothers that are gender sensitive. Another example can be found in the gender disaggregation of the cause of death statistics. This allows the comparisons of reasons for death between women and men, which can be used to introduce more targeted policy measures. And in addition to gender sensitivity in statistics, we strive to apply a life cycle approach in vital statistics. So in Korea last year, KOSTAT has linked 4 distinctive databases in births, deaths, marriages, and divorces. And this statistical production based on the civil registration allows this linkage and can be utilized for life cycle approach. I hope my statement was helpful in highlighting the importance of well-established CRV systems and its utilization for providing and supporting better police services. Thank you.
Thank you, distinguished delegates from Korea, for your statement. Now, may I invite distinguished delegates from Maldives, Ms. Fatima Riaja, Deputy Statisticians, Maldives Bureau of Statistics. Madam, floor is yours.
Thank you. Good afternoon, distinguished chair, excellencies, ladies and gentlemen. Let me begin by updating you on Maldives' work towards implementing a gender-sensitive civil registration and vital statistics system. The civil registration and the vital statistics system of Maldives stands as an example of a well-rounded system, continuously delivering on its main task of ensuring universal birth and death registration of population residing in the country. The legal framework of civil registration in the Maldives is to be mostly in the law on found in the law on birth registration and death certification enacted in 1993. Given the progress and modernization to the system since, let me state that the government is in the progress of reviewing this law and a proposal is in place to formulate a National Civil Registration Act that has a more holistic approach. According to the Vital Regulation of 2016, births has to be registered within 7 days of their occurrence and there's no exception made between boys and girls. The establishment of the online birth and death platform Gaming in 2019 has helped in improving the registration system, but some challenges remain. Along with the ratification of the amendments to the Decentralization Act, local councils and healthcare facilities are vested with the role of updating the data in the system. Here lies one of our biggest challenges, which includes building capacity of local councils and health facilities staff to operate and address the day-to-day bugs of this new system. The overarching policy of the government remains the same, that no gender discrimination is made in birth registration, death registration, and birth certificate issuance. Birth registration rate in Maldives is close to universal coverage and death registration completeness was estimated to be around 99% in 2019. Though there is complete coverage in birth registration in the country, delays in reporting from the local authority to the central system remains. However, few cases remains for neglecting to issue birth certificate. Ministry of Gender, Family and Social Services gives top priority in attending to these neglected cases. The vital statistics published annually and statistics are presented by gender. With the new integrated gaming system, we are facing delays in publishing vital statistics with implementation. Ministry of Health, together with National Center for Information Technology and local government authority, is working to closely resolve these issues. Similarly, it is mandatory to register marriages and divorces with the courts with no exception among male and female. Maldives has also made progress in enforcing legal age of marriage. The Child Protection Act, ratified on 20th November 2019, prohibits marrying any child below the age of 18. This is a milestone towards the fulfillment of children's rights in Maldives in line with the on the Convention on the Rights of the Child. Maldives has low prevalence of child marriage and it is important to closely monitor the age of first marriage among young women as a means of monitoring the unregistered early marriages in the country. The government of Maldives is committed to invest in our people to accelerate and scale up our progress towards sustainable development goals and getting everyone in the picture. We believe COVID-19 has offered us an opportunity for innovation and transformation and to strengthen the partnership. We are committed to a success story to ensure our continues to implement gender-sensitive approach in the registration of births and deaths. Thank you.
Thank you, distinguished delegates from Maldives. Now, may I invite Professor Lord Desita Chan, Philippines Women's Rights Representative to the ASEAN Commission on the Promotion and Protection of the Rights of Women. So, floor is yours, madam.
Thank you. Thank you, Chair. Excellencies, distinguished guests, good morning. Thank you to the organizers for the invitation to speak to this forum. States have committed to the universal civil registration of vital events in person's life. Still, the comprehensiveness of coverage remains challenged by factors such as availability and accessibility of official mechanisms and gaps associated with efforts not informed by the life cycle approach and gender sensitive perspective. A life cycle approach to civil registration calls for recognizing every life stage peculiar needs and interests, resulting in entitlements likely met with legal visibility. It also highlights the necessity of fulfilling the referred entitlements as preconditions to meeting succeeding ones in subsequent life stages. One example would be that birth registration will most likely facilitate school enrollment. A gender-sensitive perspective to civil registration enables authorities to recognize the gender-differentiated context likely to disadvantage women relative to the life stages. An example would be a failure to register marriages when contracted involving a child or a teenage girl may obscure crucial data on women's health. Indeed, legal visibility through civil registration guarantees rights, correspondingly a basis for claims of its fulfillment. All necessitates state accountability. Accurate and comprehensive vital statistics are crucial to an evidence-based policy formulation, program development, and strategic planning aimed at timely, relevant, and responsive action to the presenting and projected demographic characteristics. Hence, the needed resolve of UN member states and political will of its leaders to implement gender-sensitive civil registration and vital statistics system through a life cycle approach, especially if the aim is to leave no one behind and accelerate progress on the 2030 agenda. We know of states that assisted stateless individuals on humanitarian grounds. These actions are genuinely laudable, but are more sustainable when fortified by a shared standard upon which all are held accountable. Governments must establish enabling measures that render barriers to inclusive civil registration permeable, complementing them with necessary resources. As a final point of reflection, the current pandemic taught us that humanity's survival hinges on the survival of all. Thus, we must know the all as captured by accurate, responsive, and comprehensive vital statistics gathered through a life cycle approach and gender-sensitive civil registration systems. Thank you and good morning.
Thank you, distinguished delegates from Philippines, for your statement. Now in my screen, there is no request pending for country statement. So would any other delegations from a member, associate member, or observer of the Commission like to raise any other matters on this agenda item at this time? I see none. We have now gotten to the end of the statements by members, associate members, and observers of the Commission. As time allowed, I would like to now open the floor to United Nations bodies, international organizations, and non-governmental organizations in this order. Is there any request? I see none. Thank you for your interventions. This concludes the agenda item 6. It is now time to adjourn for the break. After this session, we will begin deliberations on agenda item 7, the relationship between civil registration, identity management, and vital statistics, and their role in ensuring legal identity in Asia and the Pacific, and agenda item 8 on other matters. The session will begin at 1400 hours Bangkok time. I will now hand over to the Secretariat for announcements.
Thank you, Mr. Chair. Distinguished delegates, We would like to thank you for your active participation this morning and remind you to rejoin the afternoon session using the same Kudo link at 2 p.m. We would also like to remind you that the warm-up session on legal identity will take place from 12:45 to 1:30 Bangkok time. Interested participants are requested to join the event through Microsoft Teams. Details of the event are being shown on the screen. Links to join the session were already sent to participants who registered for this event. Thank you and see you again this afternoon.
Distinguished delegates, welcome back to the afternoon session. We are now to discuss Agenda Item 7, the relationship between civil registration, identity management, and vital statistics, and their role in ensuring legal identity in Asia and Pacific. I also note that the Secretary has circulated the documents ESCAP/MCCRVS/2021/7 on intersection between civil registration and identity management systems in Asia and the Pacific, and the information documents. ESCAP/MCCRVS/2021/INF 4 on legal identity systems in Asia and the Pacific. Civil registration, vital statistics, and identity management. ESCAP/MCCRVS/2021/INF/5 on privacy and confidentiality in the context of civil registration and vital statistics systems. May I invite Ms. Rachel Beeben, Director, Statistics Division, ESCAP, to give presentation of background papers. You have the floor, please.
Thank you, Chair. Distinguished delegates, it is my pleasure to introduce Agenda Item 7 on the relationship between civil registration, identity management, and vital statistics, and their role in ensuring legal identity in Asia and the Pacific. This session is informed by 3 documents. The first document, which I will discuss later, looks at the role of civil registration in identity management systems. The second document provides more information on the relationship between civil registration and identity management systems in Asia and the Pacific. Finally, the third document provides an overview of privacy and data confidentiality issues as they occur in the context of civil registration and vital statistics practice. As explained in the first document, the provision of legal identity is part of both the Regional Action Framework on Civil Registration and Vital Statistics and the 2030 Agenda for Sustainable Development. Indeed, Goal 2 of the Regional Action Framework reflects that civil registration systems provide legal documentation of civil registration to individuals and families. This legal documentation is strongly linked with a broad range of rights and activities, in particular legal identity. In the 2030 Agenda, the importance of legal identity is underscored in Target 16.9, Universal Legal Identity for All, including birth registration. Legal identity is also acknowledged as a catalyst for the achievement of 12 of the 17 Sustainable Development Goals. To support the achievement of the Sustainable Development Goals, the United Nations adopted in 2020 the United Nations Legal Identity Agenda. It aims to develop a coherent and integrated response to the issue of legal identity, including birth registration, with a view to supporting member states. A set of guidelines have been published to support national implementation of the agenda, and a definition was developed to reflect a holistic approach to legal identity from birth to death. Legal identity is defined as the basic characteristics of an individual's identity, such as name and sex, conferred through birth registration. In the absence of birth registration, legal identity may be conferred by a legally recognized identification authority. Legal identity is retired by the issuance of a death certificate. Therefore, conferring legal identity is a function of ongoing universal civil registration. Finally, the proof of legal identity is defined as a credential, such as a birth certificate, identity card, or digital identity credential. Developing interoperable and holistic approaches to civil registration and identity management systems has many advantages. One of them is the inclusion of children in the legal identity management system. It also facilitates the maintenance of up-to-date population registers with a clear method for retiring legal identity through death registration. The holistic approach to legal identity from birth to death facilitates the provision of and access to public and private sector services. Finally, by maintaining investment in the civil registration system, it strengthens the continuous availability of demographic and health information for vital statistics. The document lists 10 opportunities for accelerated action to ensure that legal identity from birth to death is founded on civil registration. These opportunities include investing in safe and innovative technology to enhance both civil registration and legal identity, ensuring an appropriate regulatory framework, and ensuring effective data protection safeguards, amongst other opportunities detailed in the document. The conference may want to discuss these opportunities and share ideas on their implementation. Based on these findings under Agenda Item 7, it is anticipated the conference will take note of the documents and provide the Secretariat and development partners with further guidance and advice on how to implement the United Nations Legal Identity Agenda in Asia and the Pacific. The conference may also wish to share experiences and discuss efforts for continued improvement during the second half of the decade. To inform the discussions during Agenda Item 7, we will now have 3 speakers discussing the topic. Mr. Mohammed Tariq Malik, Chair of the National Database and Registration Authority, NADRA, in Pakistan. Mr. Andy Kalo, Director of the Department of Civil Registry and Vital Statistics in Vanuatu. And finally, Mr. Jonathan Marskal, Senior Program Officer from the World Bank. After which, we will then move on to the country statements. Thank you, and back to you, Mr. Chair.
Thank you, Ms. Bevan, for your introduction. Distinguished delegates, we now open the floor to our special guests to discuss on how to implement the United Nations Legal Identity Agenda in Asia and the Pacific, as well as to share their experience and discuss efforts for continued improvement during the second half of the decades. May I invite Dr. Muhammad Tariq Malik, Chair of National Database and Registration Authority, Pakistan, to discuss on the topic. Mr. Malik, You have the floor.
Hi, my name is Tariq Malik. I'm chairperson of National Database and Registration Authority of Pakistan. It's an honor and privilege to participate in United Nations Economic and Social Commission for Asia and Pacific, what we call ESCAP, and discuss what I had been advocating in my previous position as Chief Technical Advisor of UNDP. And I was doing it since last 5 years. And it is very important to lots of countries, and it should be important to everybody around the world. And it is about the relationship between civil registration and identity management and vital statistics. In this milieu, two important developments must catch our attention. If you may recall, one in the past and other directing us towards future. Let me take you to 1948 and remind you of Universal Declaration of Human Rights that explicitly contains right to recognition and the right to nationality. Now let's talk about future. In this context, that Sustainable Development Goals, what we call SDGs 16 Target 9 was set out to provide legal identity for all, including birth registration by 2030. Furthermore, legal identity is acknowledged as a catalyst for achievement of 12 of 17 Sustainable Development Goals. Hence, good governance and realization of universal human rights requires access to civil registration. Birth registration is crucial for obtaining a birth certificate or what we call breeder document, which actually establishes the first evidence of identity, his or her first legal proof of identity, therefore creating the first imprint of identity, which is so vital for any identity management system. Because in the absence of birth certificate, an unregistered child and his family undergo complex process of obtaining identity documents in later stages of life. As you know that legal ID is instrumental for enjoying universal human rights. So birth registration is not only a fundamental human right indicating social justice for all, it also ensures that a children's rights are protected or safeguarded, whether it is his or her right of health, education, justice, or guarding him or her against violence. Birth registration record helps a state to deliver all social services to the children. When I look at birth registration in Pakistan, situation is dismal. Birth registration in rural areas is comparatively 35% less than that of urban areas. So this is an extraordinary situation in Pakistan that requires extraordinary steps. National Database and Registration Authority is stepping up to the plate and will walk extra mile with federal government and provincial government. We will partner with these government institutions and international organizations such as UNICEF to register children and record vital statistics expeditiously. Let's face it, if we can't count our children won't count on state for better future. Thank you very much.
Thank you, Mr. Malik. And now I have a pleasure to invite Mr. Andy Carlo, Director, Department of Civil Registry and Vital Statistics, to take the floor. You have the floor.
Thank you, Mr. Chair. Distinguished delegates, ESCAP and United Nations and development partners, ladies and gentlemen. Tropical greetings from the Republic of Vanuatu. And I am very pleased and very proud to say to you all this afternoon that Vanuatu has just passed its new legislation in Parliament for civil registration and identity management, and also another law for national identity. And this is a historic moment for Vanuatu. After 40 years of independence, we are now able to see ourselves as Nivans based on this recognition and these rights that each individuals can actually get and produce. A legal identity in Vanuatu is established through continuous, permanent, and compulsory universal electronic registration of vital events. Birth certificates and national ID card are your trusted proof of legal identity. And it's also an output that we have a functioning civil registration and vital statistics system. Therefore, the government of Vanuatu considers civil registration as a fundamental source of registration related to identity management. The registration, as the law has now established and passed in Parliament, registration of birth is the first step in the process of formal recognition of an individual citizen of Vanuatu. Once a person has been registered, they can prove or authenticate their identity when necessary, when needed to access associated benefits and services. Government institutions in Vanuatu are now using their name or national identification number or national ID card to allow recipients of services. And in future, we want or we need the national ID cards to prove citizens so that services can be achieved or can be given in terms of schools, hospitals, passport, voting, banking, traveling, and many more. We understand the need to collaborate and require improvement in the CRVS system. Therefore, the government of Vanuatu from 2017 up until now approved a national CRVS policy and a national identity policy. The identity policy and national CRVS policy will be reviewed next year to go in line with more new policies, with more initiatives coming up, such as voting using national ID, registering SIM cards using national ID, or any government services that is required will be tailored to use national ID. I believe this drive will really push Vanuatu in its efforts to create national identity for its citizens and achieve its overall objectives. However, achieving the CRVS goals, such as legal identity for all, also means creating a demand for services. To create such demands, the government of Vanuatu will develop policies and strategies based on its cultural and geographical context, and will allow the Regional Action Framework for Asia and Pacific to support this government to focus its efforts to realizing those three CRVS goals. Therefore, finally, to conclude, the government of Vanuatu is committed to achieving Sustainable Development Goal 16 and Target 16.9 by 2030, provide legal identity for all, including birth registration. We are confident of this target, as the government sees that it will achieve this before 2030, and therefore enabling government strategic planning and focus based on these now two new approved bills that were passed yesterday and today. I thank you all for your listening, and may God bless you all. Thank you, Mr. Chairman.
Thank you, Mr. Carlo. For our last guest speaker, Mr. Jonathan Marskel, Senior Program Officer from World Bank, to take the floor. You have the floor.
Thank you, Mr. Chair, and greetings everybody from Singapore. The World Bank is pleased to be co-organisers of this ministerial conference and these important sessions on legal identity. We'd like to congratulate the ESCAP Secretariat for organising the ministerial conference in these very unique and difficult circumstances. Before I begin my remarks, I do want to start by expressing condolences to the family, friends, colleagues of Ms. Alimua Mua Malafono Alatawa Fa'asalaina, the government statistician of Samoa, following her tragic passing over the weekend. I had the good fortune myself of working with her personally and closely on the Samoa National Digital ID project. She was a brilliant leader, a wonderful person, and a great counterpart. Coming back to the agenda, it goes without saying that legal identity is important for development, including to enable people to access services all people to access services and economic opportunities, as well as to exercise their rights. Digital forms of legal identity can assist the government and private sector to deliver their services more efficiently, effectively, and innovatively. This was clear during the pandemic. Countries that had inclusive and trusted ID systems designed as service delivery platforms were better equipped to roll out comprehensive social protection and public health responses and to maintain continuity of business and operations and economic activity by shifting from in-person to online transactions with the same amount of trust and security as if their clients were visiting physical offices. The ESCAP region has a number of good examples in this regard, such as in Australia, India, the Republic of Korea, Pakistan, Singapore, and Thailand. It's for these reasons why the World Bank Group has digital ID and CRBS as a priority. Through the Identification for Development Initiative, ID4D, our global data and CRBS programs, and hosting of the GFF, we are providing technical and financial support to countries, developing cutting-edge knowledge in global public goods, and augmenting these agendas through advocacy and partnerships. In total, right now, we have more than $1.5 billion of active and pipeline financing in 37 countries for digital ID and CRBS. We're pleased also to be doing this in collaboration with the UN agencies and the UN Legal Identity Task Force, academia, civil society, the private sector, and other stakeholders. Specifically in the ESCAP region, we are providing financial and technical assistance for CRBS and digital ID activities in more than a dozen countries, such as Indonesia, Kiribati, Lao PDR, Pakistan, the Philippines, Samoa, Tonga, and Timor-Leste. This covers design, implementation, legal and institutional frameworks, civil society and stakeholder engagement, monitoring and evaluation, among other areas. Inclusion, cybersecurity, data protection, and technology neutrality are fundamental to these engagements. We're also working with a number of countries on mutual recognition and interoperability of digital IDs across borders in order to unlock opportunities for digital trade and economic integration. All of this work is anchored on the 10 principles on identification for sustainable development, which provide a guiding framework for maximizing the development impact and minimizing the risks of digital ID systems and CRBS systems. These principles were co-developed and have been endorsed by 30 international organizations, including many UN agencies such as UNDP, UNICEF, UNHCR, IOM, WFP, UNCDF, and UNECA. And fortunately and importantly, they've been adapted by several countries in the ESCAP region, such as Timor-Leste and the Philippines. A key feature of this support is to help countries to identify and develop the linkages between civil registries and ID systems, as well as simultaneously strengthening these mutually beneficial systems. For example, the SHIFT development policy operation in Pakistan is promoting linkages between NADRA and provincial civil registries. As described in the background paper for this agenda item, these intersections help to modernize legacy processes to reduce the steps needed to complete civil registration and vice versa help improve the sustainability, integrity, coverage, and quality of ID systems. But for these benefits to be maximized, it's important that the models and approaches for these linkages are adapted to local conditions and priorities. A one-size-fits-all approach will not work. ESCAP member states have made a lot of progress in this regard, and this should be recognized and disseminated both regionally and globally. In closing, we look forward to hearing the views of member states and scaling up our support on CRBS and digital ID activities in the region. And as noted earlier, these are critical issues that can enable a resilient recovery and better planning and monitoring, as well as accelerate the transition of all countries to inclusive and dynamic digital economies, societies, and governments. Thank you, Chair.
Thank you, Mr. Marscal. Distinguished delegates, the floor is open for your comments. The first speaker is Dr. Claire Denise Mapa, Philippines, to be followed by Dr. Hongyin Liu, China. Distinguished delegates from Philippines, the floor is yours.
Thank you, Mr. Chair, Excellencies, Madam Executive Secretary, distinguished delegates, colleagues, good afternoon. Philippines reaffirms its commitment to the Asian Pacific Civil Registration and Vital Statistics Decade 2015-2024 and the region's continuing endeavor to realize the community's commitment for an inclusive CRVS and identity management system. We also reaffirm our commitment to the 2014 Ministerial Declaration and the Regional Action Framework on CRBS in the Asia and the Pacific as we strive to get everyone in the picture, extending to the United Nations Legal Identity Agenda and its goal to manifest universal legal identity for all, including birth registration. The Philippines, through its different agencies and partners, firmly and further supports the development of an inclusive, interoperable, and holistic identity management and CRBS systems in realizing the functions and critical roles of the declaration, framework, and the two agendas, UN Legal Identity Agenda and the 2013 Agenda for Sustainable Development. The Philippine Statistics Authority, with its different partners in government and in the private sector, ardently supports the strengthening of inclusive legal identity system in Asia and the Pacific. While the Philippines is undergoing crucial development in the foundation of its national identity management system, it aims to reconcile CRBS and national identification systems, furthering the integration of both systems to fulfill the government's commitment of service to the public with a centralized or decentralized authority on both systems essential to strengthening the legal identity system of the country. In recognition of the importance of fulfilling the goals stated in the Ministerial Declaration and strengthening legal identities through enhancing the existing civil registration system, the Philippines extends its utmost support in improving policy, implementation, and the quality of life of CRBS products and services in Asia and the Pacific. Member states and their respective governments all aim for both an inclusive civil registration and vital statistics and identity management systems. While all of these are goals to further sustain existing systems, it is also important to recognize the needs of hard-to-reach and marginalized population, whether geographic limitation, political and socioeconomic, and historic cultural barriers. With this, the Philippines recognizes the possible alleviation of the conditions of states and their respective peoples and the consequent achievement of the 2030 Agenda and the SDGs. The Philippines fully supports the principles on which the implementation of the United Nations Legal Identity Agenda stands and calls for a more active and resolute regional collaboration. Finally, the Philippines also recognizes that as the region fulfills its commitment to each member state, governments may encounter challenges, issues, and systemic barriers internationally, regionally, and nationally in implementing courses of action that will achieve our set goals. Nevertheless, despite the lasting impact of the coronavirus disease, the Asia and the Pacific community of nations and development partners will leave no one behind and will take all opportunities for accelerated action to put everybody's on track in fulfilling the agendas, the SDGs, the Ministerial Declaration, and the Regional Action Framework, and ultimately, the second half of the Civil Registration and Vital Statistics Decade. Thank you very much, Mr. Chair.
Thank you for your statement. Next speaker is Dr. Hong Yan Liu, China. May I invite Mr. Hong Yan Liu to take the floor.
喂，可以听到吗？哎，好。尊敬的主席先生以及各位参加者，大家好。出生是生命登记的最起始的点，那它与许多其他服务都相关联。那我很高兴在这里能介绍一下中国的出生一件证多证联办的做法。在中国，医疗卫生机构签发出生医学证明，据此，公安户政部门为新生儿办理户籍登记并获取身份证明。医疗保障部门、社会保障部门依据身份证明办理医保证和社保证。与此相关的民事登记涉及4个部门，因手续繁琐且易造成登记信息漏报和不一致问题。近年来，为了有效提高民事登记水平，中国政府在完善立法、政策和实施条例的同时，各地也在因地制宜地改革与完善民事登记管理方式。其中，浙江省开创出生一件事多证联办改革项目颇有成效。当前，中国的住院分娩率达到99%以上。浙江省将出生登记窗口迁移到产科病房，新生儿出生后，监护人不再需要跑到多个民事登记机构分别进行民事登记，而是可以选择在助产机构床边、综合行政服务窗口或通过 APP 在线进行出生登记，再由系统自动推送到公安、医保和社保部门。原来涉及4个部门的登记环节整合为一个，材料精简到1份。在办理新生儿出生医学证明的同时，会自动获得户口登记、医保参保、社会保障等多个民事项目登记，并申领相应的法律证明文件，办证的时间也平均压缩到3天内。信息联通使得数据交换为多证联办提供了基础。通过数字技术应用简化了登记流程，广泛应用刷脸申请、身份认证、电子证照、电子签名等新技术，建成跨部门、跨系统、跨层级的出生一件事联办系统。该一体化登记系统不仅支持出生医学证明、人口信息等证照和数据和信息的全程对接与跨部门调阅流转，而且也能继续用于日后其他生命事件的登记，例如婚姻、生育、领养以及死亡登记，为民众全生命周期连续永久的动态统计奠定基础。出生一件事联办、多证联办，便利了民众进行出生登记，有效提高了公众的满意度，也有助于降低登记漏报、错报，提高了民事登记和人口动态统计的数据质量，是创新民事登记和人口动态统计实践的成功案例。那我们在第1天也听到新西兰的做法和我们国家的做法很多做法是相似的，我们也希望我们这样的一些成功经验能够在亚太地区进行推广。谢谢。
Thank you, Dr. Hong Yan Liu from China, for your statement. Next speaker is Mr. Anil Chaudhary of Bangladesh, to be followed by delegates from Mr. Francis Maki de Leraga Nauru. May I invite Mr. Anil Chaudhary to take the floor.
Thank you very much, Mr. Chair. I'd like to thank ESCAP and other organizers for hosting this very timely conference, despite the very challenging circumstances around the pandemic. Civil registration, as we know, comes from a rights perspective, whereas the national ID comes from a service delivery perspective. In the 131 years between 1873, I repeat 1873, when civil registration was introduced in this region of the world. So between 1873 and 2004, 131 years, we only registered 8% of Bangladesh's population. For the last 16 years, since 2004, we have covered over 80% of our citizens, including adult population. So that's over an 80 times efficiency increase, if you look at it that way. The average time to register birth went down from over 10 days to below 5 hours now, a 98% reduction. And the average cost went down by 40%, and number of visits to complete a birth registration also went down by 40%. But if you look at the numbers, and my colleague Shahidul actually presented these numbers earlier, the numbers are not very promising yet. The birth registration rate of children under 1 is still less than 30%. But then if you look at birth registration of children under 5 years of age, it stood at 20% in 2014 when the CRVS decade was declared, but it actually went up very sharply to 71% in 2019 because primarily it was linked to school enrollment, that birth registration was necessary for school enrollment. However, during COVID, this actually fell because schools were closed for the most part for almost 18 months in Bangladesh. So the number actually fell to 56%. So under 5 years of age, registration fell to 56%. So what this points out is that it's very important to link civil registration to various service delivery options. On the other hand, what we have seen in terms of take-up of our national ID, which is biometrically verified, when we started it was a voter ID, biometrically verified with 4 fingerprints. Now it has been upgraded to 10 fingerprints and iris, and we're also looking at other biometric options. So since the beginning, after the voter registration, we actually linked the national ID to many different service delivery. And the adoption has been increasing day by day. I'll again take a couple of examples from the pandemic time period. We have seen social safety nets in recent couple of years, and especially during the pandemic with an eKYC platform started by our national, our central bank, where we saw great adoption for the national ID because it was linked to the social safety nets introduced for the new poor caused by the pandemic, job losses by the pandemic. We also saw great adoption of the national ID for vaccination because vaccination registration required the national ID. It's only recently that we are seeing, again, use of birth registration and civil registration for vaccination because we introduced vaccination for children below the age of 18. So that's when we actually see uptake of the civil registration process. What this requires is an integration between our 2 parallel systems, the civil registration, that's the jurisdiction of the Ministry of Local Government, and the national ID, which is the jurisdiction of the Election Commission. So for the last few years, we've been exploring how to integrate these 2 systems, both from a technical interoperability standpoint, but also from an organizational standpoint, 2 different organizations. But what we see is a coordination setup that we have set at our cabinet division, chaired by the cabinet secretary, the National CRVS Steering Committee, that has really helped in this integration. It's not just a technical integration, as I mentioned, it's really integration of organizations. And we also brought in health, the health ministry, because we have great success, over 99% for child immunization around the entire country. And what we are exploring right now is the introduction of a unique ID, which basically bridges our CRVS system and our national ID. So unique ID given at birth or during immunization, and that becomes the unique ID that will be used for civil registration purposes and also for national ID purposes, and will be linked to many different type of service delivery from birth to death of a person. So that's the current exploration that we are doing, integration technically and also integrating organizationally. We have seen success of that in one sub-district of the country where birth registration under 1 actually went from a very low number to quite a high number, over 80% within a matter of 2 years, because this integration was done in that location. So we're taking cue from there, taking that pilot and we're scaling that up nationally. So over the next few years, we're very hopeful that we'll be able to achieve universal birth registration, universal civil registration under 1 year. Thank you very much.
Thank you, Mr. Anis Chowdhury from Bangladesh, for your statement. Is there any other member states who wish to take the floor? Okay, then we will have the international organizations to take the floor. The first speaker is Mr. Romanian Santon, to be followed by delegates from UNHCR. Distinguished delegates from CRVS. The floor is yours.
Thank you, Mr. Chair. Distinguished delegates, colleagues, ladies and gentlemen, I'm pleased to deliver this statement today on behalf of Vital Strategies, a global public health organization and a partner in the Bloomberg Philanthropies Data for Health initiative, as well as a co-organizer of the Ministerial Conference. I'm honored to address this session on making the United Nations Legal Identity Agenda a reality in our region. This agenda has brought needed clarity to the foundational role CRVS plays. Translating it into the functional CRVS ID ecosystem needed to meet both individual and good governance responsibilities is now the challenge. As indicated in the background papers, good governance and achievement of universal human rights requires access to legal identity, which is critically important to promote equity and inclusion and access to services. I would like us to first reflect on the wide and virtuous array of mutually reinforcing benefits, at the heart of which is a well-functioning CRVS system that embodies the principle of the legal identity agenda. As part of the resurgence of interest in CRVS systems, the link between the universal provision and retirement of legal identities, improved cost of death data, evidence-based policy making, and efficient service delivery have been explored and written about by many. We also now understand how to equip governments to identify where system improvement of a technical nature are required to enable universal registration and to implement them. New technology-enabled solutions are being deployed to support improved business processes for registration. Through the Data for Health initiative and others, CRVS legal and regulatory frameworks are being updated to enable CRVS ID best practices. Lastly, while population register may represent an innovation in some country setting, they should be called out for their importance in serving as a connection point for CRVS and ID management system in many countries. Looking ahead and building on this momentum, and given the roadmap provided by the legal identity agenda, we must ask how this system's improvement can be translated into maximum impact in the daily life of policymakers and citizens alike. We have, in our experience, observed that the success and sustainability of improvement depends on CRVS champions and strong inter-stakeholder collaboration and coordination. Ensuring this between the civil registration, health sector, ID management, and statistical authorities in pursuit of the legal identity agenda is especially important. It is one of the most important steps a country can take. Doing so will result in a more efficient, complete, and proactive CRVS system, producing timely data that are trusted and used. This is a web of relationship required to achieve universal registration. This complex web will only be as strong as the weakest link in this chain. Recent years of investment are bearing fruit in all areas and provide cause for optimism. Realizing the potential of CRVS to benefit all, however, crucially depends on strong leadership and coordination among all government agencies and stakeholders are key to advancing the system, to building the interrelation, and to ultimately ensure that systems are counting everyone and enable efficient service delivery. Getting everyone in the picture in the remainder of the CRVS decade have never been more possible. Thank you very much.
Thank you, Mr. Santon from CRVS. Next speaker is Mr. Matthias Luis, to be followed by Member State Nauru, Mr. Francis Maki. Distinguished delegates, Mr. Lewis, the floor is yours.
Thank you, Chair, for giving me the floor. Distinguished delegates, excellencies, ladies and gentlemen. Civil registration is the basis for identity papers, and identity papers are the basis for the full realization of human rights. This holds true for everybody, and it also holds true for persons under UNHCR's international protection mandate. Identity papers facilitate access to health, education, and livelihoods. They prevent human trafficking, the exploitation of children, and child marriage. Yet for persons under UNHCR's protection mandate, identity papers have an additional dimension. They facilitate access to solutions. Yesterday, I spoke on behalf of UNHCR about the link between civil registration and durable solution for refugees. Today, I would like to add some remarks on access to nationality. In practice, the realization of everyone's right to a nationality as enshrined in the Universal Declaration of Human Rights often fails due to the lack of proof. And first and foremost, this means a lack of birth certificates and identity papers. Birth certificates usually indicate person's place of health, parentage, and often the nationality of the parents. Having birth certificates significantly reduces the risk of becoming stateless. And even for stateless persons, a late birth certificate may be the first step towards the acquisition of legal identity and thus create an opportunity to apply for naturalization. There is no automatism leading from birth certificates to nationality, but making civil registration and identity management systems accessible for everyone will go a long way in reducing statelessness risks among hard-to-reach and vulnerable population groups. Reflecting on the region's way forward, let me share with you the experience of our partnership with the ASEAN Commission on the Promotion and Protection of Women and Children. Over many years, we cooperated to promote sustainable development through ensuring legal identity of women and children. In 2020, the ACWC launched the study on legal identity of all women and children in ASEAN. I'm pleased to report that the outcomes of this study are now being translated into concrete activities in Cambodia, Indonesia, the Philippines, Thailand, and Vietnam. I would like to thank all of our partners for their trust and cooperation with UNHCR. We assure you that UNHCR remains committed to civil registration and legal identity documentation as instruments to give access to protection and solutions. Thank you for your attention.
Thank you, Mr. Matthias Ruiz from UNHCR, for your statement. Next speaker is a delegate from Member State of Nauru, Mr. Francis Maki. No connection. Then next. There seems to be some connection problems. Would there any other delegation like to raise any other matters on this agenda item at this time? I see none. Thank you for your interventions. This brings us to the conclusion of the discussion under agenda item 7. We'll now move on to agenda item 8, other matters. Distinguished delegates, it's now the time for last agenda item, other matters. Under this agenda item, the conference is invited to take note of the following. The chair and the vice chairs of the senior officials segment of the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and Pacific examine the credentials of representatives received by the member states in accordance with Rule 12 of the ESCAP Rules of Procedures. The Bureau noted that credentials have been received by a total of 43 member states and found them to be in order. Are there any other matters which any member would like to bring to the attention of the committee? I see none. Distinguished delegates, if we do not have any other matters to proceed, it is time to adjourn for today. It has been my honor to chair part of the meeting of the senior officials segment. I would like to thank the chair and other vice chairs for their excellent collaborations. I would also like to extend my appreciation to all of you for your great participation and fruitful discussion we have been through to get everyone in the picture. I look forward to seeing you tomorrow in the high-level segment of the Second Ministerial Conference on Civil Registration and Vital Statistics in Asia and Pacific, during which the report of the Ministerial Conference will be adopted. The opening of the Ministerial segment will start at 10 Bangkok time tomorrow. I now declare the senior officials segment of the Ministerial Conference adjourned. I now give the floor to the Secretariat for their administrative announcements.
Thank you, Chair. Distinguished delegates, thank you very much for your active participation in the senior official segment of the Ministerial Conference. May I remind you that before we start the opening of the Ministerial segment tomorrow, interested participants are invited to join the Ministerial Roundtable on Pandemics, People and Preparedness, Civil Registration and Vital Statistics, COVID-19 and Health, starting at 8:30 Bangkok time. The link to join the event was already sent to registered participants. Information about this event is being shown on the slide. Kindly note the link to access the conference through Kudo tomorrow will be the same as today's. However, the link for YouTube tomorrow will change and is available in the program. Delegates who join via Kudo are welcome to join 30 minutes before the session starts for connection testing. Have a good evening and see you all tomorrow.